All right, so next is our pursuit system. We talked about pursuits a lot already. And that's just it with eye movements. They all affect one another. One can benefit the other. So it's hard to only just really separate them because they're just meant to work together. So a pursuit motion is when you hold the image of a small moving target on the fovea. This is a pursuit motion, okay? Now, the important speed there to be mindful of is 30 degrees per second, because when you reach that, then you start generating saccades. So they're slower eye movements. Earlier on, this is something Dr. Carrick had shared that I thought was so valuable, especially when it comes to reading. When you saccade a lot, you lose vision, right? Because during the very short duration of a saccade, it's very fast. You're blinded during that quick movement. But with pursuit, a slow tracking, you're absorbing everything in your visual field. So when you read, your eyes jump, through the sentence in different spots. Some people pick every word out. Some people look every other word or every three word, or they'll pick out the entire sentence at one time. So the less saccades you have, the more efficient your reading is, and also the faster it is. But if you can train yourself to try to pursue through a sentence and just slowly move through, it's kind of hard to do initially, then you're going to just pick out everything that you see, and you'll be able just to keep working your way through those lines. So the pursuit system is really a great system to use to absorb more out of your visual field. And it just doesn't work in a lot of cases. It doesn't work well in cases of dyslexia, it doesn't work well in cases of ADHD, it doesn't work well with autism, and with a lot of developmental disorders, it just doesn't work well. There's a lot of people who are not diagnosed in either of those categories, but have an impaired pursuit system. So it's really important that everybody be tested, because the way that you gather information from your visual field, which is really valuable, it's our most dominant system or sense, so you want it to work well. But even when it comes to posture, the vision is secondary only to the vestibular system when it comes to maintaining good balance, good posture, and good movement. So we want that system to be as top-notch as it can be. So with pursuits, if you find intrusions in your assessment, then we want to use strategies to restore them. And those strategies are going to be similar to a lot of what we learned in the gaze stability exercise. Now, when you pursue to the right, you activate primarily that right parietal lobe and the left cerebellum. But also it's the right pons. We had a case earlier where we used, actually, I think this one was left. It was a left pursuit motion, because the left pursuit motion activates the left parietal lobe, so the left cortex, and the left pons. My patient had a pons lesion on the left side. Cool thing is that not only does the eye movement to the left engage the left pons, but activating the cortex on the left, the cortex has projections that go directly down into that PMRF, that pontomedullary reticular formation. So you have that as well. So that one left pursuit exercise activates really two regions that can project down into that left pons. And so this can be very helpful clinically when we do pursuits on the vertical, up and down like this. Then you're activating both sides, and you're activating the mesencephalon, because that is where the muscles that move the eyes on the vertical are going to be your superior and inferior, superior rectus, inferior oblique on each side. So two eye muscles on each side, and then to come down you have inferior rectus, superior oblique, those two eye muscles on each side. And those all have innervations that come from the midbrain. Okay? The innervation of the lateral movements really come from the pons. Okay? So, with an impaired pursuit movement, again, it's really hard to say for sure specifically where the problem is, because it could be in multiple areas. So it's not super specific. When you see an impaired pursuit system, you say, well, Could there be a parietal lobe issue? Well, maybe, but there's a really strong possibility that that there isn't, and that the problem is coming from somewhere else. And so the pursuit system and the optokinetic system and the VOR system, they use similar pathways, so we can kind of use one or the other to help supplement. If your horizontal pursuit mechanism is impaired, then using a no-no strategy where you're actually using that vestibular ocular reflex to either stabilize the eyes, or maybe you can do it in counterphase to a pursuit motion. So as I'm following the pursuit, I'm moving my head in the opposite direction. This is called the ×2 viewing. You could do that with your exercise. You need to determine if it helps the patient. If you do it at bedside and you see right away that it's helping, then you want to use that. With a right eye system, you can just test that horizontal pursuit only. It takes 30 seconds to do. You know, you can do that strategy, put them back on the right eye, retest just that, and compare. You should see a change right away. You should see an improvement right away. If it's going to work, it doesn't take weeks and weeks and weeks to make a difference. It'll make it right away. So another important thing too is the saliency of the target can make a huge difference. Just by using a target that is brighter, or that is more colorful, or that is more interesting. So I'm going to go to my pursuits over here. In my settings, and here we have target type. And if I were to use random, what will happen is the target will move across, and then when it generates the next pursuit, it'll be a different target. So it's different every time. So it's more interesting. But that may not be enough. You know, sometimes if you use like a crosshairs, you can really focus on the center. And especially if the target is larger and your patient is scanning through the target, that can affect the smoothness. So if they're able to focus on the crosshairs, that can help improve it. Or you can upload your own image. You know, if you could take a picture of something. I don't have any loaded in here. I don't think I do. No, nothing. Nothing interesting. So, but you can take a picture of the patient. What I like to do is I'll ask them, you know, I'll try to use, with a picture, I use the biggest image, the biggest size possible. So I'll use the largest size for the target. And I'm going to ask them questions about different parts of the image. I may say, you know, do you see the eyes? Is there anything interesting about the eyes? Do you see the tongue? Is there 1 year, 2 years, depending on the age of the patient? You say something kind of silly. Where's the third year? You know, and they're like, third year? And then they look around, where's the third year? I don't know. But, you know, that increases their attention. Pick a different picture for the next rep, the next set, and ask questions about what's in the picture. That's what I do with my autism cases that have very poor gaze fixation. If they can understand what I'm saying, and I'm going to do a no-no strategy, I'm going to put a big sticker on my forehead, and I'm going to draw something. And if they're responsive, I'm going to say, what do you see? You know, ask questions about the image that I drew, and it gives them to be really attentive as I do my no-no strategy. So the saliency makes a huge difference, but we can just use a different color. So let's just say we'll do just a random target like that. And maybe there's a color that they like better than another. Maybe a color they're more attentive to. We'll just say purple. So you can play with that, with the size of the target, the color of the target, the kind of target that you're using. Or you may want to use little monsters or sports items. And what will happen here is it'll alternate a different image each time. So there we get the yellow one. Here we have the purple one. And that can improve attention significantly. Okay? And it could be that pursuing like that will improve the pursuit mechanism, and that could be therapeutic. So also another thing we can do is gaze stability exercises. So maybe we might want to make the target hold before it starts moving. Let's just say, for example, the initial hold time will be 4 seconds. Well, we'll go to 5, get a little longer. And before we start moving, I'm going to do a no-no exercise, maybe just 1 or 2, really good quality, and then pursuit. Okay? Or maybe I could do just a quick Haumagi motion and then slowly bring my head back to center and then let it pursuit across. That might help. Maybe I'm going to do a ×2 viewing. So I'm going to move my head in the opposite direction as the target pursuits across. Maybe I'm just going to do an optokinetic before, maybe 5-10 seconds, and then do a pursuit motion, and that might make it better. Okay? So pursuits are useful to, again, ADHD where they like to saccade a lot. You can use pursuit training to kind of build that system and restore it. You can do head pursuits. So that's another option is, let's say here, I'm going to just pick a different direction. We'll go left this time. We'll use sports sets. And we're not going to hold initially. Okay. And here I'm going to follow with my head. So my nose is pointing at it. Okay. And maybe I might want to make it sinusoidal. Go back both sides. You know, if I have this just rough, I may have these rough intrusions or little intrusions. You see the eyes just kind of shake when they're moving. So let's make it sinusoidal. So that way I'm going to follow with a ×0 strategy all the way through that horizontal plane. And you've got a target that keeps changing. That's nice. It keeps your attention. You wonder what's the next one going to be like. And you can use little monsters. It'll rotate through 9 different ones. Okay, so that's the ×0 strategy. And ×2 would be moving your head in the opposite direction. Okay. Now, one other feature that we've added here, and we're still kind of tuning that one up a little bit, but we've got the circular movement as well. And the benefit of this, I'll cover a little bit more when we get into the maintenance exercises at the end, but we can run a pursuit clockwise or counterclockwise. And this will just engage every eye muscle. You're going to cover all of them. So it's just a great exercise to activate all the muscles. You know, is it clockwise and versus a counterclockwise, more one hemisphere of the other? It's really hard to say for sure. I think it's probably more likely to be a mix. I do wonder if a clockwise motion is more of a right brain and counterclockwise left brain. I don't know. I really don't know for sure. I think that's something we need to study. I don't know if anybody knows, really. Excuse me. But in this case here, we're going to have a pursuit motion. And see, it's not perfectly smooth yet on here. We're still tweaking that one a little bit. And if it's going, if you select sinusoidal, it'll run one way and then come back the other way. Okay? If you were to take that off, then it will just keep going the same direction. So here we would have, right here, sinusoidal, take that off. And then it'll just run that way. So done. And it'll just go the same direction the whole time. Predictability helps to improve smooth pursuits as well. If you know where it's going to go next, there's a good probability that it'll be more efficient than if it's completely random. So in our cases, we use predictability a lot in these exercises. Also, attention improves the smoothness of a pursuit. We covered that already. So you want to pick things that are really useful. Now, here's something else I could share. If I had a little sticker, I've got some somewhere in the clinic, but if I had a little sticker, sometimes I have them hanging around, I could actually put the sticker, let me change this here. We're gonna do a horizontal pursuit, and I want to show you how something simple could actually make a pretty big difference in the effectiveness of the pursuit. And I don't think I've heard this anywhere else before. Maybe it has been shared and I just don't know about it. But let's just say that if I were to put a sticker on the screen, Skylar, in the back office, in my office next to the computer, there's little red stickers. If you just grab that, that'd be great. So if I were to run a pursuit straight across like this, and I put a sticker, it could be a sticky note, it could be a little round red sticker on this side, away from the direction of movement, it would slow down or impair the movement, potentially. You know, people with really great brains probably wouldn't affect them. But if I put a sticker where the target is going to, that's the first version. If it's away from where it's going to, it's a distractor. If it's where the target is going to, that's an attractor. And so you want to attract the target to that location. So here I'm pursuing, but I can see in my peripheral vision that target there, and it's going right to it. That's an attractor. If you're using an attractor, you can actually improve the efficiency of the pursuit. Okay? Just a little trick like that can make, again, a pretty big impact. You know, if you're using an iPad, you can put that on the iPad, you know, where it's going, just on the edge of the iPad like that. Okay? All right, so that covers it for pursuit. Do you have any questions on pursuit? Anything you think we may have missed? You know, in the bedside exam, there's the diagonal pursuits. And the reason for those is because, you know, when you move your eyes on a diagonal plane, it requires a tremendous amount of coordination from the brain, especially the cerebellum, because it's what allows you to move better, move faster, more efficiently. There's a lot of constant fine-tuning. We don't have, you know, it's a combination of all the, you know, of multiple muscles working together. Well, when you move the eyes on a diagonal plane like that, this is more of a left, this is for the left cerebellum here. The eyes would move in this plane. And then in the other plane, if it were the right cerebellum, we'll cover that a little bit more later. And this plane would be more of a right cerebellum. We can do that. I can't say I've really used that therapeutically. I think you could, if you want to use the pursuit system and really activate a cerebellum as well. We certainly use the combination of pursuits and saccades together to be really effective, and we'll cover that in a moment. But therapeutically, I think there's no limit to what we may need. You know, certain patients may require something that you haven't thought of until it presents itself. So you want to be open to all those. So, good.
I think your emphasis of always enforcing gaze stability, if they can fixate on something first, and then they can work on pursuit.
Yep.
Since it's a movement.
Yep. Yeah. So, yeah, that gaze system, you want to use it to your advantage, especially with pursuit. You want to do everything you can to improve attention, improve gaze function, and that'll help to improve the pursuit. So, but again, you know, if you're looking at horizontal pursuit and there's, you know, I see that a lot on horizontal pursuit. Sometimes you'll see intrusions. Well, the intrusions can happen in the plane of the pursuit, or they can happen in perpendicular plane of the pursuit. If they're happening in plane, I want to know, are they mostly to the right or to the left? And if it's both right and left, I want to see, is it really to the right when I move to the right? Or is it to the left when I move to the left? Or vice versa? You know, as my eyes move to the right, is the intrusion going the other way? So you want to see what direction they're going, and that might help guide the head strategy, so that you can oppose that intrusion with your head. So if they're going down, you're going to do a down head movement to push the eyes up. If they're going to the right, you might want to do more of a left head movement, and then you can kind of match your pursuit motion too within that. Maybe you might want to make it stop, you know. And that's the cool thing about our gaze feature in here, is that you can actually, where is it here? Gaze stability. You can actually make any motion. You can make a pursuit motion or a saccade motion, but you can make it stop in the center. So if I want to set up a left to right pursuit, but I want it to stop in the middle, you could do that. You can make it stop in the middle, do your head strategy. You may do a head strategy before it starts moving, in the middle, and then at the end possibly. So, okay, so that's it for pursuit.